Hey guys, my name is Dr. Taiwo Adeshivin. I am a bilingual board-certified orthopedic clinical specialist as well as residency trained. And we are going to be starting a series called 5 Things That I Wish I Knew About Low Back Pain. When we think about low back pain, there are so many structures in your back, from your ligaments, your discs, your nerves, your muscles, that can generate pain. So it's very, very difficult. In fact, most cases, the low back pain, there is no specific cause. Because just think about it. If we could say that this low back pain is because of this structure, realistically, people wouldn't be in the therapy clinic, but I see it every single day in my clinic. So clearly, it is something that has to be individualized to determine what truly could be the causing factor of your low back pain. Secondly, CT and MRI often don't correlate with the patient's symptoms, which is why I educate patients. It is important to understand that while there's a place for MRI, if there are truly some things that are more concerning, oftentimes this is not going to be the dictating factor of our treatment plan. And to continue on, as I mentioned in that first point, it is something that is multifactorial, from genetics, from physiology, from lifestyle, such as in the PT world, we're also taking in things to consideration, such as whether if you have limited mobility, too much loading, or not enough loading. Different factors like that have to be taken into account. And regardless of symptoms, the end goal should be incorporating an exercise-based program that is individualized for you. I would love to say that 1, 2, 3 exercises is going to fix your back pain. However, everybody's spine is so different. So find a PT that can help you create a plan that's fit and best for you. And then for my athletes, once you do return to your sport, it's important to understand that this needs to be very progressive, meaning a monitoring of your load. Because when you get back to the sport, you are having to change directions, accelerate, decelerate, and this requires a lot on the spine. So if you have the opportunity, as professional athletes typically will have what we call this GPS tracking monitor system to really see how much an athlete is doing. Now, if you do have the opportunity to be in a setting where you can have a GPS tracker, which is able to really determine how much workload you are putting on the spine, that would be a great thing, because you do have to find a fine balance between training and recovery to ensure that you aren't going too fast with your overall recovery. And here at Viva Motion PT, we will be incorporating GPS tracking for